permanent restorations or permanent crowns on dental implants, what will be the ideal time for us to move from a temporary restoration to a permanent crown on a dental implant? This was asked by one of the subscribers. She had got her dental implants done and she has been on a temporary teeth for about 3 months now. She was asking, when is the ideal time to change into a permanent teeth? Have I waited too long? Should I wait more? Was our question. To answer the question only, we are doing this video. This is Dr. Arun from Pearls Dentistry, running a dental centers from Chennai, Raja, Namalipuram since year 2001. If you have not subscribed to our channel, Pearls Dentistry, please do subscribe. We're coming out with a new video every day. Now, when it comes to restoration, permanent restoration on dental implants, I would consider it as 3 important things which we should consider when we can move on. 1 is the number of implants, 2 is the quality of bone, 3 is the shape of a gum tissue. Now let's look at one by one. When you look at the number of implants, when you do more number of implants, it is possible to give a permanent restorations on those implants much quicker than when we are doing only one implant. So that is number of implants. Why am I saying this? Because when you do more implants, each implant can be supportive of the other implant to take the load of the permanent teeth. So because it is supportive of the other implants to take the load of the permanent teeth, we will be able to restore it into permanent restoration very quickly. So something called an immediate loading is possible. When I say an immediate loading, it can be a permanent teeth can be fixed on it in within the 2 to 3 weeks time or under 2 months time itself. It is possible to give a permanent teeth on that. Almost immediately we can load those implants with permanent teeth. When it comes to only one single tooth, and especially on our molar region, it is always advisable we evaluate whether that implant can take up all the forces of chewing on that particular tooth at that particular point of time and then take a call. Sometimes it will be advisable we wait for the entire 3 months healing to happen before we actually load that implant. The reason simple is that the reason the tooth could have been broken is, for example, the patient would be a bruxer, right, the heavy bite force, and the tooth would have broken. And when you're going to remove a broken teeth and then put an implant there, like an immediate implant there, already there's no bone, the force of biting is very high. It's not advisable to load the implant immediately. So we wait for full 3 months time for healing to happen before we can actually load the implant. So that is regarding number of implants. So when it comes to the quality of bone, as I said, if a bone is very adequate, we have abundant bone, there is good amount of bone that supports our implant, then it is easier for the implant to be well anchored in bone, because it's easier for the implant to be well anchored in bone and there is good amount of bone supporting our implant. It is possible to give a permanent restoration of the implant almost immediately. Immediate mode is always possible. When it comes to an extraction socket, or when it comes to very poor quality of bone with very spongy bone, like sometimes it happens in the upper back teeth region, or where the bone is very thin and soft, it is always advisable to wait for extended periods of time. When I say extended periods of time, it can be anywhere from 3 to 6 months time. Especially when you are grafting, that is, our own bone is less, but our grafted bone is more. We wait for extended periods up to 6 months time before which we can actually load the implant. The third important thing I said is the quality of our gum tissue. Sometimes we can do more number of implants. Our bone strength can be very adequate with implant being well anchored in bone. But sometimes to develop a gum tissue, the doctor might choose to give you temporary tooth, allow the gums to completely heal around the tooth, and then contour the gum in such a way when we give a permanent crown on that particular implant, it looks as if it's coming out naturally from the tooth, and no one can actually differentiate between our own natural teeth and the implanted teeth. So that's one area where, to allow the gums to heal, we can wait up to 3 weeks time for the gum tissue to mature around the particular teeth and then give a permanent teeth on the implant. So I hope we answered this question of when is the ideal time by these 3 different things, right? The number of implants, the quality of bone, and the gum tissue conditioning that needs to happen. If you have any questions, please do ask in the comment section below. We'll be happy to answer. If you like this video, please do hit the like button, share it with others, and of course please do subscribe to our channel Pearls Dentistry. Until next time, bye bye and thank you.
வீடியோ பிடிச்சிருக்கா லைக் பட்டன் கிளிக் பண்ணுங்க, சப்ஸ்கிரைப் பண்ணுங்க, பெல் ஐகான் கிளிக் பண்ணுங்க. இந்த மாதிரி வீடியோஸ் உங்களுக்கு வரும். Thank you.